Hello and welcome. I'm Jamie Callie with RWJBarnabas Health Medical Group. Today I'm joined by Dr. Chatterjee and Dr. Riaz, and we're here to talk about healthy aging. Welcome to you both. Thank you for joining me today. If you're here and you're live with us, thank you for being here. You are more than welcome, if you have questions, to type them in the chat, and we will do our best to answer them at the end of the program. If not, I just hope you enjoy. And if you're watching the replay on social media or YouTube, welcome to you as well. I'm going to jump right in with the first question. Dr. Chatterjee, Dr. Riaz, feel free, either one of you can lead us off with the first answer. But the webinar is called Healthy Aging, and I hoped you two could maybe describe what you would say to a patient looks like healthy aging. How would you tell them an individual looks if they're aging in a healthy manner?
So could you rephrase that question again?
Sure. How would you describe healthy aging if a patient came in and was looking to age well? How would you describe that in like in sort of medical terms? What does a healthy older person look like?
Sure, I can start if Dr. Chatterjee is okay with it.
Mm-hmm.
So, I like to, when I'm discussing this with my patients, I tell them aging is a very natural part of our existence, right? Getting older is a privilege, right? It's a privilege to see more birthdays, to get those grays, to experience all of that. It's not something we can, or more importantly, it's not something we should be trying to prevent, really. What's important and what my goal for my patients is to make sure we're aging successfully. And that looks differently for different people. But most importantly, for the most part, we're going to try and preserve as much of our functioning as we get older, maximize our abilities, right? Optimize all of our senses as we get older. Of course, we're going to be meeting more challenges as we get older, and it's important to be prepared for those challenges. So in that fourth quarter of life, we want to be thriving and not just surviving.
I completely agree with Dr. Riaz. The most important indicator of aging or successful aging is functionality. So that means that you should be able to live independently, able to take care of you independently, and if you're able to do a lot of things to embellish your life by independently, and I think the bottom line is function, and there are many impediments to be able to function as you get older, and you have to address those challenges and optimize your functionality so that your latter years are as well preserved as when you're younger.
Excellent. And I like that Dr. has used that word of thriving, because I think especially when you're younger, it's easy to feel that way. But there's obvious differences when you age and what you could do when you were 20 or 30 or even 40 versus what you might be able to do when you're 60 or 70. So I like that word. And going off that response a little bit, what are some activities or just sort of even just daily habits that you would recommend to patients to sort of help them stay in that thriving kind of mode as they age?
Sana, okay, so basically, I think the key is three things. Number one, to have a relationship with the physician and follow their instructions, which means getting your health screening when it's time, when it's appropriate, getting all the blood tests on time, in time when it's appropriate, going for cancer screening when it's appropriate. Medication compliance, that's a huge thing. A lot of folks, compliance is a problem, whether it's because of the way the medications are set up, or just because they just don't believe that the medications are going to help them. I think medication compliance is a huge factor in successful aging. most people that I have seen that are doing well in their older years are folks that have been to doctors on a regular basis, that have taken their medicines on the regular basis, and have, you know, gotten their cancer screening, their immunizations. The second thing I think is being active and being and exercising. And we all know that exercising or fitness in older adults has three components. The first component is obviously cardio, and we tend to focus on cardio too much. You know, cardio includes walking, jogging, biking, uh, swimming, that kind of stuff. But what we tend to forget are the other two components of physical activity, and that is strength training and balance training. So, in addition to um, aerobic exercises, I recommend that you start off with basic strength training and you work your way up, and that will in turn preserve your muscles. So as we get older, our muscles tend to shrink. It's called sarcopenia. So in order to prevent sarcopenia or prevent it from happening too quickly, we need to start strength training. And last but not least, of course, is balance training, because if your balance is good, then there's a less likelihood that you'll fall, and there's a higher likelihood that you'll be able to function independently. Sana, you want to add anything to that? Or
Yeah, no,
anybody else?
exactly what you just said, Dr. Chatterjee. You covered it so well. I like to explain it as balance is a skill that we learn when we are toddlers. We learn how to balance our weight on our knees and on our hips, the weight-bearing joints, and it's a skill that diminishes as we get older. So exercise is really, just like Dr. Chatterjee said, the best intervention that has been known to decrease risk of injuries and falling. In addition to that, balance training and strength training, at least a couple of days a week, in addition to the aerobic component of the exercise. I like to describe it as aerobic will get your heart rate up. The other ones is, and that should be at least 5 days a week for 30 minutes or 20 minutes daily. And then the strength training and the balance training should be a couple of days in a week. So it's really all three to prevent injuries. In addition to that, just like Dr. Chatterjee said, controlling your vascular risk factors. So making sure your blood pressure is optimized, your cholesterol numbers are good, you're eating well, and making sure you're staying physically, mentally, socially stimulated as you get older.
Excellent. And I just want to clarify, when you say balance training, are you talking things like yoga, or is there another type of balance training that you recommend to your patients?
There's yoga, there's Tai Chi. So really, finding a form that you enjoy doing and staying consistent is key.
Consistency is key, yes. And I know you both touched on this a little bit in terms of that balance is really the key to avoiding falls and most major injuries as you age. But is there anything else that you would add to help reduce the risk of injuries for your patients?
Right. So again, the best thing you can do is optimize all of your senses, right? So make sure you get your eyes checked once a year. Get your hearing tested, get those hearing aids. And if you are investing in them, make sure you're using them, because a lot of times people have hearing aids, but they don't use them. Hearing loss is associated with both increased risk of falls and as well as memory loss. So we take it very seriously. Um, if you have neuropathy, if you're diabetic, making sure you're wearing proper footwear, checking your feet daily. And, most falls and most injuries happen at home. They happen in the bathroom. So making sure your environment is safe. So getting rid of clutter, loose cords, rugs, throwing them all out, throw out those step stools, make your bathroom safe, make sure you have grab bars, you have a shower chair, invest in a walk-in tub, walk-in shower, I mean, and just making your home as safe as you possibly can in order to prevent injuries from happening. And falls will still happen, so having some kind of alarm system in place if you are a frequent faller. So alerting a loved one, be it via Alexa or a smartphone. I'm sure Dr. Chatterjee has more to add.
Yeah, no, no, you covered a lot. You covered most of it. What I'd like to add is adequate lighting, especially at night, because we know that most falls occur at home in the bathroom. So, the path to the bathroom should be clutter-free. There should be no throw rugs or cords. The other contributor to falls is polypharmacy. Being on too many medicines with a lot of side effects. So, um, uh, if you can get rid of or eliminate excessive medicines, that would help. So polypharmacy and getting rid of excessive medicines is another way to kind of reduce the risk of falls.
Excellent. I think those are a lot of really practical things people can think about. And it's sort of, you can take them in steps as you age and as you hit different milestones in your life as well. You don't have to turn 60 and just throw out everything in your home. But, as you notice yourself aging and things like that, you can make those small incremental adjustments. So it doesn't sort of feel like it's all happening all at once. And I think that's, I really appreciate you giving such detailed answers for that. I know another component that a lot of people worry about when they age is memory loss. And when do you recommend someone either speak to their doctor about their general risk for memory loss, or if they feel like they're becoming more forgetful, when is it the best time to sort of address that so it's earlier on in case it's something more than just, general forgetfulness?
Well, memory loss is most often brought to our attention by family members or friends or spouse, a child, when they notice, forgetfulness, erratic
Mhm.
behavior, inability to perform tasks that they were performing quite adequately, getting lost while driving, having trouble with names, forgetting
Mhm.
words. Sometimes it's the patient becomes aware of their memory impairment, and they will, of course, bring it to your attention, bring it to the attention of the provider. But I think the key is for the provider to be alert to the possibility of memory loss, because
Mhm.
oftentimes when we just get into daily life and we're seeing patients on a regular basis, we sometimes just forget that memory loss could be creeping in, and it's sometimes you know appears insidiously, and it gives you little indicators, and sometimes we fail to pay attention to those indicators. So I think a lot of it is dependent on the provider. So Medicare offers you this option that's called the annual wellness visit, and one of the components of a well done annual wellness visit involves memory screening, and it can be done very quickly using a tool called the MiniCog, or if you want to expand it a little more, you can use a tool called the Mini Mental Status Examination. So I think being alert, not only uh, from the point of view of family, but also from the point of view of providers, is the key to detecting memory loss early and being able to intervene early.
Excellent. Dr. Rees, do you have anything you want to add?
Yeah, the memory loss, all of us are going to have some degree of decline as we get older. All of us forget where we kept our keys, or, if we turned the stove off as we walked out this morning. A big red flag is when it starts interfering with your daily functioning, right? So are you missing appointments? Did you forget to pay the bill? Or are you confused about medication? So those are kind of the red flags that I want my patients to tell me about. Once you start struggling with your activities of daily living, that's when we want to know and we want to intervene. The other example I like to give is the difference between a normal brain and normal aging and forgetfulness versus an Alzheimer's brain. As someone with a normal brain will eventually be able to deal with that problem, or um, retrieve and remember where they kept the keys. And right, an Alzheimer's patient is going to find those keys in the pantry or in the fridge, or they'll find them and they won't know what to do with them. So when you start seeing those deficits, then you want to let us know.
Excellent. And I had one last question to wrap up our discussion with. But if anyone has a question and wants to type it in the chat now while we talk through this last question, just as sort of a general, when do you recommend your aging patients to see a geriatrician to, like have that additional consult with that specialist? Is there a hard age that you would say, or is it just as you notice certain ailments or things are cropping up as you age?
Well, my personal recommendation is, although I'm biased, that everybody
Yes.
should see a geriatrician at least when they turn 65, and although there's a dearth of geriatricians in this country, every person should look for one and at least have them, in their patient panel, in their doctor's panel, so that if there is a need, they're available. And geriatricians, of course, also serve as primary care physicians.
Mhm.
A lot of our work is devoted to taking care not only of the geriatric aspects of aging, but the patient as a whole. So yeah, I'd recommend that you stop by and see a geriatrician when you turn 65. You may not have to come back um, and visit them for a couple of years, but it's always good to check in when you turn 65.
Sort of
I
have that
completely
initial
agree with that.
meeting with the doctor. I'm sorry, Dr. Rees, did you have something to
So I
add?
completely agree with that.
Oh,
65 and older.
excellent. Yes, and like you said, it might not be a specialist you see every 6 months or every year right away, but it's good to have like that sort of foundation of the relationship there. So 70, 75, as you're getting older, maybe and you want to see them, it's their face already and the practice.
Exactly. And when you start to have a functional decline, that's when it's imperative that you see a
Mhm.
geriatrician. Because first of all, geriatricians are trained and have the wherewithal, and they usually have the support to help you deal with your functional decline. Whereas when a person is in private or solo practice, they don't have the luxury of
Mhm.
time or the resources. And so and geriatricians can also serve as an extension of your care. You may continue to see your primary care physician, but the geriatrician can be that additional
Mhm.
resource, the additional help that is available in case you need it.
Excellent. Well, I know we do have one question that was emailed in ahead, and we have one question from the live chat. So let me go ahead real quick with the one that was emailed in. Someone had a question. They are a person over 70, and they were wondering if there's any multivitamins or minerals or supplements that you recommend, or if there's any that you suggest patients just avoid altogether.
Yeah, it's good to take like any multivitamin is fine. Vitamin D 1000 international units is recommended. The ones that I would like to avoid, and we have some new studies supporting that, is niacin and vitamin E. So those in excess can actually do more harm.
Oh, good to know. Dr. Chatterjee, did you have anything to add or?
Uh, I'm not a big proponent of vitamins. I think if you have if you eat a healthy diet, a
Mhm.
well-balanced diet, which is rich in fruits, vegetables, uh, nuts, berries,
Mhm.
cereals, I think you can get all your vitamins and your minerals. Some folks have deficiencies, and those deficiencies cannot be corrected by diet alone. So people who have vitamin B12 deficiency need a monthly supplementation or a weekly supplementation. But my general recommendation is, if you have uh, the if you have access to a healthy, well-balanced diet, I think
Mhm.
that covers most of your vitamin requirements. Rarely, if you're not exposed to the sun that much, you may take a vitamin D supplement as Dr. Riaz recommended. Vitamin C and vitamin E have fallen out of favor.
Mhm.
The recommendations for vitamin D were much higher in the beginning. Now you know the recommendation is much lower. So my recommendation is eat a healthy diet,
Mhm.
exercise. That'll that is more beneficial than
Mhm.
buying a lot of vitamins.
Excellent. And like I said, we do have one question in the chat. This person says that they are over 85 and still do most things that they need to that need to be done. However, sometimes they have some short-term memory challenges. Is there anything that you would recommend at this point? Overall, their health is good.
Shall I answer that?
Yeah,
Okay,
go for
so
it.
so the first thing that the fact that this person was able to frame that question means that they seem to be aware of what's going on. Now, Dr. Riaz mentioned this before. There's something called pathological memory loss, and there's something called normal age associated memory impairment. Okay, so as people get older, it takes them longer to recollect information, and it takes them longer to process new information. But eventually they're able to do that and they're able to function. People who are unable to do that have dementia. So if you are, so you have to go to someone and uh, determine whether you have the normal age-associated memory impairment or you have something pathological going on, and and then you take the next step. But again, that determination is important. But one thing to keep in mind is that you can um, feel that you're having certain lapses in your memory, and that is not necessarily pathologic, meaning that's just normal age associating memory impairment. And so, if you're functioning well independently, most likely what you have is not pathological, it's not dementia, it's normal age associated memory impairment.
Excellent. Dr. Rees, did you want to add anything or?
No, pretty much what Dr. Chatterjee said. I would recommend that you see your primary care doctor or a geriatrician for that matter to get some testing done. Part of the initial workup is checking some cognitive labs as well. So like Dr. Chatterjee had mentioned earlier, the vitamin B12, we want to make sure that's at a good number. And then we want to make sure the thyroid is functioning okay. And the cognitive testing would be to differentiate it from a normal aging versus
Mhm.
mild impairment versus a dementing illness.
Excellent. Well, thank you both so much for joining us. I don't see any other questions in the chat. Just give it another second. Was there anything either one of you wanted to add on the topic of healthy aging before we signed off for the day? If not, I think we covered a lot of good ground here, especially in the beginning when you were describing, Dr. Chatterjee was describing some of his steps to help the aging process and to keep you healthy and fit. Um, but if neither one of you has anything to add, then we can sign off for the afternoon.
I would recommend, my three recommendations.
Mhm.
I want to reiterate them. Number one is to exercise uh,
Mhm.
as often as you can. Of course, you have to be safe and maintain safety. Number two, follow up with your doctor. Pick a doctor, follow up with your doctor, and then follow that doctor's recommendation. Those are the three keys. If you follow your doctor's recommendations, take the medicines the way you're prescribed, and exercise, I think that's what I would do to age, in a healthy manner.
Mhm.
I'd just like to add that, the fourth quarter of life, it's a privilege to enjoy it. And of course, there will be challenges and that will be thrown during this last quarter. And it's important to have a plan and to be prepared for those challenges. And meeting a geriatrician, you're really putting into perspective how you want to spend that fourth quarter of life and how to maximize your abilities, during that time. So.
Mhm. Excellent. Well, thank you both for joining me today, and thank you everyone who is on the live with us as well. I hope everyone has a great afternoon.
Thank you.
Thank you
Pat.
for having us. Take care.